Presentation is managing stress-induced insomnia through Ayurveda. Myself, Dr. Rishu Sharma, presently working as assistant professor at Govt Ayurvedic Medical College, Jammu Kashmir, India. So, before I start my topic, let me introduce with my topic, that is insomnia. Most of us are dealing with it in one or other day. So, what is basically insomnia? In Ayurveda, we consider it as anidra. The word means absence, and the nidra indicates sleep. So, anidra is the lack of sleep or any um, alteration in the quantity or quality of sleep. As we all know that sleep is one among the best tonics and elixirs of life, and Ayurveda specially mentions that the three sub pillars of one's individual's life are ahar, that is the diet we take, nidra, that is the sleep we take, and the brahmacharya, that is celibacy. These are the three supporting and and the most important pillars of one's life, which plays a very crucial role in maintaining one's health. Also, any alteration in the quantity or quality of sleep, we notice, may lead to physical or mental illnesses. Sleep disturbances often leads to many psychiatric illnesses. Due to stressful life, our life is so hectic these days that um, insomnia is becoming a threatening and very emerging disease worldwide. As we all know that when we can't take proper sleep, it leads to various disorders, and it also affects our daily routines and normal activities. In the modern science, you see they usually give sedatives or tranquilizer drugs to combat this disorder, but these cannot be taken, these should not be taken for a longer duration of time, as they lead to more dependence and often addiction. So in this presentation, I am here to present what Ayurveda understands insomnia and what is the kind of management of insomnia through Ayurveda. So, Ayurveda considers nidra or sleep as a basic, as a pillar of one's life, and when one is having a good sleep, Ayurveda considered the person to be as happy, and its physical and mental well-being is much more, much as compared to the person who is having a lack of sleep or who is having insomnia. Insomnia is not a disease. It is basically it is caused due to a number of reasons, like a stressful event or anxiety or any depression or any psychological disease. Um, Also, sleep is considered as a primary indicator of one's quality of life, and it also plays an important role in maintaining one's health and pain perception. What is insomnia? Is basically sleepless. Some of the symptoms of insomnia include sleeplessness in every 3 to 4 days a week, awakening at usually midnight, with related GI problems, body pains, and related issues like depression, anxiety, etc. In Ayurveda considers insomnia as the root causes vitiated vata, pitta, and kapha. Basically, insomnia is due to vitiated vata. When vata dosha increases in our body, it results into insomnia. Kapha when symbolizes in the body like stability, lubrication, and fluid balance, and pitta and vata are basically the factors responsible for sleeplessness. and that too Vat is considered more. Now, the not taking up much time, I'm taking into consideration the management part. Ayurveda advocates some fruitful panchakarma therapies. Some panchakarma therapies for the insomnia, like Nasya. Nasya is the installation of medicated swarasa or medicine through the nasal route. Murdhini Chikitsa means Murdhini Chikitsa, it includes four basic therapies that is Abhyang, Sek, Pichu, and Basti. These Murdhini means the head region, and the therapies pertaining to head region are included in these. Among these, Shiro Abhyanga, that is head massage with some medicated oils. Next, the Seka, that is Shirodhara, matlab, means some medicinal fluid or medicinal oil or medicinal um, milk, etc., are poured into the head with a very good stream. Next is the Dhara, Abhyang se Pichu. Pichu means installation of some oils over the head for a longer duration of time. And Basti is the Shiro Basti, in which we put some oil into the head for a longer duration of time. Next is the Shirodhara, where constant installation of medicinal fluid or medicinal oil or takra or milk, etc., are poured over the forehead in a continuous manner for some time. These are some pictures which are displayed over here. The picture in the left indicates the Shiropichu. Here, the cotton is, or the towel of cotton is dipped with the oil and placed over the head. Okay, this is the Shiropichu. And in the image over the right is Shirobasti, in which some cap, leather bag is put over the head and tied, and the oil or medicinal oil is poured slowly by slowly. That is put lukewarm, and it's put slowly and slowly up to the 16 anguls now over the scalp. This is Shiro Abhyang, or we considered it as massage. In our text, in Ayurveda, it is mentioned that Abhyanga, that is massage, these are helpful to promote nidra or sleep. Okay, and it reduces the stress. In Ayurveda, it is mentioned that head massage or head massage and also the foot massage, the soles of the foot, should be done on the daily basis. And these are advised for many psychosomatic disorders. Next is the Shirodhara. This is the picture indicating the Shirodhara, in which some medicated oil are put into the vessel and instead on the forehead of an individual or the patient in the continuous pendulum-like manner for a particular duration of time. It is the rejuvenating therapy, and it is very beneficial. It is very beneficial in the patients of insomnia, in the patient of depression, in the patients of anxiety, in the patient of psychosomatic disorders. These oil is poured on person's forehead for a from a specific distance. There's usually 6 anguls or 2 anguls, and at least for a duration of 30 to 45 minutes. Some herbs which are mentioned in Ayurveda to combat this insomnia are the class of Midya Rasayanas. Midya Rasayan, Acharya Charaka, as we all know about Acharya Charaka, they have mentioned about Midya Rasayanas, Manduk Parni, that is Centella asiatica, and Shankapushpi, Convolvulus floricollis. Beside these, some other drugs are also there, like Yashti Madhu and Gogrita also. These are helpful in managing insomnia. Also, some drugs like Brahmi, Jatamansi. These are also an ashwagandha, Withania somnifera. There are many researches are being there, and they have proved very beneficial effects on the patients of insomnia, because these drugs works on the samprapti vigatan, that is vata dosha, which is mainly basically involved in causing insomnia, and hence are quite effective in curing this. Beside all the therapies, we always Ayurveda believes on the Nidan Parivarjan. Nidan Parivarjan means the cause, the main causative agent or causative factor which is inducing insomnia. So we have to cut that factor. That is, if there is any sort of stress, there is any sort of mental impairment, or there is any sort of anxiety, you have to eliminate that. Okay, leading to and after that, these therapies, it leads to deep relaxation, which leads to normalization and stabilization of mind. There are some daily habits which can overcome insomnia. First one is try to sleep early. Try to sleep early. Sleeping time is the period, because sleeping time is the period our brain stabilizes the organs, nerves, and cells of the body get energized. So, awakening for a longer duration of time may disturb our sleep cycle and hence leading to insomnia. Next, eat a decent meal before bed. Try to consume less, because when we consume more, automatically our GI tract and our gets affected, and which often leads to disturbances in the sleep. Also, you should take a light diet and include soups or salads in your dining plates. With this, I would like to conclude that insomnia is a very crucial condition and so much prevalent in the society that it affects the quality of life and may contribute to many illnesses. Modern pharmacological agents are having their own limitations, and hence Ayurveda may play a role here by correcting the physiological aspects of sleep. Ayurveda is capable of addressing issues like insomnia to a great extent and can really contribute to the whole medical world. Thank you.